Yes, welcome back. This is Mr. International, Mr. Pop, Mr. Stable. Yes, so now we are talking about the extrapyramidal side effects, and we have talked about acute dystonia. Then we also have got akathisia, and this one can develop in a patient after days of drug administration, and this is characterized by um, severe motor restlessness, which is misinterpreted as anxiety disorders. So, or you can say this is the inability for the patient to stand in one place. Akathisia. Yes. The number three, sorry, it is pseudo Parkinsonisms. Why pseudo? I'm sure you know what are called the Parkinsonism diseases. But here is pseudo. Why? Because it is caused by medications. So it is pseudo Parkinsonisms. And this one, it can come into the patient after weeks of drug administration. It is characterized by acute muscle rigidity, tremors, and bradykinesia. Bradykinesia simply means slowed movement. The fourth one, we have neuroleptic malignant syndrome. So this one is characterized by unstable BP, confusion, and high fever. And usually it can develop in patients after months of drug administration. The last one, we have tardive dyskinesia. So this one, it is characterized by involuntary movement of the muscles of the face. Understand? And this side effect can come after years of drug administration. Yes. So those are what we call um, extra pyramidal symptoms. And as a student, you must master them. And I'm sure if you can go through the past paper of May 2021, you are going to find a lot of these medications. Yes. So the next implication of the typical antipsychotics is that you have to give a lot of oral fluids to prevent the dry mouth which is caused by typical antipsychotics. And also, you must never give these medications. You should only give these medications before and after checking the BP. And also, you must caution the patient about the use of heavy machines. Then also, you must weigh the patient weekly to prevent obesity. Understand? Yeah? Yes. So sometimes they can also, yes. So for the typical antipsychotics, I'm sure I have provided 99% of the information. So in summary, these medications which are called typical antipsychotics, for you to see the recovery, they don't take minutes, they don't take hours, they don't take days, they take several weeks. That's why those who are working in the hospital, when relatives come, you must cancel them to say, you have brought your patient, but let us do our job. For you to see the improvement, these drugs do not work like a headache. Whereby when you take Brufen, you get better. No. Then also, apart from these medications, the typical antipsychotics, for them to treat psychotic disorders, they can also be used to treat non-psychotic conditions. For example, they can be used to treat vomiting and hiccups. So Lagactil can be used as antiemetics. Now um, let's jump to the atypical antipsychotics, and these were discovered in 1960s after the first antipsychotics which were discovered in 1950s. So Indication, they are saying these medications are indicated for negative symptoms of psychosis. Though for me, I can't agree. But since this is what is there in the books, I'm going to agree with you. So let's give examples of the drugs which fall under atypical antipsychotics, also known as the second generation. We have risperidone or Risperdal, and this one comes into 2 milligrams, and also it comes in form of injectables, 25 milligrams per ml. Then we also have got quetiapine or quetiapine. This one comes into 25 milligrams per tablet. Then we also have got clozapine. This one comes into 50 milligrams per tablet. Then we also have got olanzapine. This one comes in sometimes 10 or 5 milligrams per tablet. Then we also have aripiprazole, comes in 5 milligrams per tablet. So those drugs, they fall under new generation. The advantage of the new generations of antipsychotics is that they are associated with fewer side effects. Understand, yeah? Yes, but they are quite expensive. That's why Zambia is a developing country. Ideally, we are supposed to be using these, but sometimes we might not afford to buy each and every drug because they are very, very expensive, though risperidone is present. Yes. So, the side effects, they can also cause sedation, but in rare situation, they can cause extrapyramidal symptoms. But these drugs, like clozapine, it causes granulocytosis, which is the destruction of white blood cells. So if they ask you to say, what is the advantages of the new generations over the old generations, you just say the new generations has got fewer side effects as compared to the old generation. What is the disadvantage of the old generation over the new ones? It's vice versa. So please, people, let's understand. So here on this topic, they are going to ask you a question like, what do you call the groups of the drugs which are used to treat mental disorders? They are called psychotropics, number one. Number two, they are also going to ask you to say, what do you call medications which are used to treat psychotic disorders? They are called antipsychotics. Then they will also ask you to say the antipsychotics medications in the brain block which receptors? The answer there is the dopamine receptors. They will also ask you to say the first typical antipsychotics were discovered in which way? The answer in each year, so which way? The answer is the 1950s. Understand? Yes. Then also, the mode of action of the typical antipsychotics is based on the dopamine theory or dopamine hypothesis. Then they also ask you to say, when a patient is taking haloperidol for 7 years, they are at risk of developing which extrapyramidal symptom? The answer there is tardive dyskinesia. Sometimes the acute dystonia, the akathisia, the pseudoparkinsonisms, the neuroleptic malignant syndrome, and the tardive dyskinesia, they will bring it on the cross match. So nakuza niko on chape. So take this information very, very serious.